I'm trying to record a video. Yep, I've got somebody staring at me. So if you see something in the background while I'm recording, you'll know what it is. Morning, guys. It's early, but I wanted to get on and discuss a few things about implants. For those of you that are thinking about getting implants, haven't started the process, or maybe have started the process and just need some additional information. I've been wanting to discuss these things for a while, but I haven't because I know what my thoughts were and my opinions were, but I didn't have any facts or anything to back it up. And I didn't want to get on here because I'm not a dentist. You know, I didn't want to get on here and start talking about something that I really thought that I had an idea about, but didn't have any idea about, if that makes sense. So now I have facts to back up what I've been wanting to speak of. So, and I feel like knowing this stuff, if I don't pass this on to you guys, and somebody else goes and does this and has trouble, then I feel like it's my fault. Or that, you know, that I could have prevented this. So, we're going to talk about teeth in a day, and we're going to talk about going outside the U.S. for implant surgery, okay? Now, I realize there are people in my group and people that subscribe to me that are in other countries that are thinking about or maybe have gone outside of their country for implant surgery. I don't want to speak about that because I don't know. I mean, I just don't know anything about it. I know a little bit about going outside the U.S. for implant surgery now because I've talked to some people. So now let's talk about the whole teeth in a day thing. My process took a little over a year. I did great, and the results have been great, okay? And I know a lot of people have asked if I know anything about teeth in a day. There's been people in my group that have posted wanting to know about teeth in a day. And I have a few dentists in my group. I've got one, though, that has a blog. And I was reading his blog last night, and he has a post on teeth in a day. And I read through that, and he's got some fantastic things in there that you really, really need to think about. Okay, sorry. I wanted to pull up his blog, and specifically the section where he speaks about that, so I can kind of reference that. But I've always felt like if you're going to have implant surgery, it's best to do it in stages. That's what I went through. And just from my experience, I could not imagine having teeth extracted, having implants put in immediately, and then the snap in or the bridge. Okay. Now, I do realize there are some people that have done this and have done fine. Okay, and I'm not talking down. I'm just. Or people, I guess, that are planning to do this. I'm trying to think of how to say this because I don't want to offend anyone. But because there are some advantages to teeth in a day. But very few people are candidates for that, okay? There are certain things that you have to, that you cannot have, or let me just read these to you. Okay, to be a candidate for teeth in a day. This comes from Dr. Robert Emilio's blog, okay? You have to be a non-smoker. You must have great bone quality and quantity to anchor the implants. And he says, I mean very good. You cannot be a diabetic or a highly controlled diabetic because your healing is compromised. Everyone knows that. Most people know that. He says, IV sedation is preferable because you got to remember, if you do go the teeth in a day route, you're going to be in that chair for 6 to 7 hours. I have terrible anxiety. I can't sit in a dental chair for an hour without having to get up. They know that at my dentist. So that's the reason I did IV sedation for my implant surgery. It's just because I can't sit still. And he says if you, to be candid for Teeth in Today, it really needs to be somebody that cannot tolerate wearing an upper denture with the palate, okay? Because you gag easily. And what he's saying there, or what I think he's saying is, when you go through the stage approach of getting implants, there is a period of time where you will be in a temporary denture. I was, okay? And the temporary denture has the full palate. It's just a regular denture. So, and he says that if you have a job like where you're a TV anchor or you're a public speaker, and it's something where that you really need a non-movable appliance, then you probably should really consider Teeth in a Day. But he goes on to say, if you are a candidate, should you do it, okay? And he says, he thinks, sorry guys, his answer is no. Sorry, I'm reading off this. And I'm going to tell you, I'm not going to read off this, but I'm going to tell you what I read. There's a couple things, and it really makes sense if you think about it. A lot of us, when we go to have our teeth extracted, a lot of us have infected teeth, okay? My teeth, I had 4 left on top, and I don't think I had a really bad infection, but I had some inflamed gums. So he put me on antibiotics. And matter of fact, that's the reason why he didn't want to put my implants in that day. And there's a reason for that. If you go in with teeth that are infected, okay, and they extract those, Dr. Emilio says it's not a good idea to put implants into an area that's got an infection. And that makes sense. You have a greater risk of them failing. You know, the implants are sterile fixtures, okay? You take something sterile like that and stick it in something that's got an infection in it, peri-implantitis. You have a greater risk of failure. Also, and getting anesthetic, I did not know this. This is a really good thing, a really good point, and I'm glad I read this. He says injecting anesthetic into an area that is infected can cause something called cross-contamination, okay? Evidently, when you do that, the infection can spread. But that's why it's better to have, especially if you have infected teeth, to have the extractions first, heal, take the antibiotics, get rid of the infection, and then do the implant surgery. Also, he made a point in here that I really wished I would have known, because I've said this before in other videos. I had already paid my dentist for the extractions and implant surgery, okay? Or I might have reconsidered, because I had the extractions, got put in a temporary denture, okay? Had the implants, the temporary denture went back on. I wore that temporary denture, which was a regular full denture, for almost a year. The implants were not active or were not snapped on. I adjusted to that fine. I adjusted to it rather quick. I ate fine with it. So his point is, and if I could go back, I've told you this before, I probably would have not gotten the implants on top right away. Because for me, I don't think it was necessary. Do I love my snap-on denture? Yes, absolutely I do. I love it. But to save money, I would have rather have saved that money, because I'm about to have to have my lowers done. And now I'm in a situation where I don't know where I'm going to get the money. So I could have used that money to get the implants on the lower. But he also makes a good point where if you go the route where you do it in stages, he said you may find that you do just fine in a regular upper denture. Or you do just fine in dentures periods where you don't need implants. That could save you a lot of money. Implants aren't cheap, you know. But, of course, there is the alternative where you may find that you just can't do without them. So this gives you a period of time to really think about this investment. Also, he talks about another aspect of waiting and do it in stages is you'll have better looking teeth or better aesthetics. And that's a good point. I love the way my teeth look, but it took a year, and we had a dental technician, a denturist on site, and he was great. But evidently, if you go with teeth in a day, hang on, let me see what he says. Okay, he says that when you do the teeth in a day scenario, a stranger laboratory technician decides for you your denture, tooth shape, your shade, and the positioning of how you should look. He says that's a big jump to the unknown. And he says aesthetics need to evolve during the healing process because your facial features do change dramatically after full mouth extractions. And that's a great point. If you go lower, go slower, and do this in stages, then you have a better, you can give your input on what you want, how you want the teeth to look, the shade, the shape, etc. And again, I want to say that I know people that have done this, and they're very happy with the outcome. And I'm tickled to death for you. I am not in any way downing anyone that's done this. I just want to give people that are thinking about doing this and have not gone through the process yet something to think about. He also says at the end that there's a lot more advantages to slow down the process and do it in stages. I'm going to post the link to his blog in the description section. There are a lot of good things he talks about, he discusses. After extractions, you know, what to expect or what's going to happen, taking antibiotics. There's too many to name. It's a great blog with a lot of great information. Now, let's talk about going outside of the U.S. for implant surgery, okay? Now, I realize I have subscribers that are in other countries, and I have people in my group that are in other countries. I am not familiar, and people that may have gone outside their country for implant surgery. I am not familiar with that, and I don't even want to begin to try to speak on it. I am a little familiar with going outside the U.S., okay? So, and I just feel more comfortable approaching it that way. In my group, I've got almost 800 members now, okay? I talk to people through Messenger, email, on the phone, text, all day, especially on the weekends. Since I've had this group, I started it back in July, I have had 2 people message me that have chosen to go out of country for surgery, for implant surgery, okay? And they did not have good outcomes. I feel like I'm not going to mention their names. One was a U.S. person that went to Mexico. One was someone that lives in another country that went to another place. And I'm not going to mention it to protect them. But I've spoken about this before a lot earlier when I started my channel, but I didn't think it was a good idea, but I really didn't have anything to go on, any facts or any situations that I knew of that had went bad. I know a couple of my subscribers have gone to Mexico and have done fine, okay? And I'm very grateful for that. But if you are thinking about doing this, I want to give you some things to think about. Let's start off with this, and I had to write this down. Our dentists and oral surgeons in the U.S. have a lot higher standards and regulations than dentists, let's say, in Mexico, okay? Our dentists in the U.S. Have a lot of schooling, continuing education, courses and stuff that they have to keep up with to keep their licensure, okay? That's not the case in these other countries. So that's number 1. Number 2, if you go out of country, you're going to be, you might as well say you're going to be doing the teeth in a day, okay? It's a 3 or 4 day process, or it's done over a week. You might as well say it's a teeth in a day. It's not a staged approach like I went through, okay? So you've got to think about the whole teeth in a day scenario that I just talked about, okay? Another thing, when you come back home, are you going to have money set aside to fly back in case something were to happen? More than likely, you are going to have an adjustment done to your teeth once your gums start shrinking. Your gums will shrink and you will have bone loss where there are not implants, okay? You're going to have to go back, or find a dentist in your area that will work on someone else's work. So that if you do have trouble or you do need an adjustment, they will see you. So you're saving money initially, but in the long run, are you really saving money, okay? Another thing, our laws over here do not protect you if you go out of country. You know those sheets you sign? I've signed a ton of those. Before you have extractions, you sign these consent forms, okay? Well, I've read through them, I have, but I'm going to be honest, and I think most of us have done this. When it's time for you to have an extraction, most of the time you're sick and tired of dealing with it. You're in pain. You may scan through that sheet and say, "Oh, okay," and sign it, and you're just like, pull it, because that's what I've done. If you go out of country, you really need to think about what you're signing, okay? Because you know, I forget what some of these consent forms say, but there could be a possibility another tooth could be fractured in the process, which if you're having full mouth extractions, that wouldn't matter. Could be a possibility that you could have nerve damage, I think. Okay, if you're in the U.S. and you sign a consent and that happens, our laws will possibly protect you, okay? If you go over to Mexico and do that and you're signing a consent form, then you're giving consent, and if something happens, you're pretty much going to be stuck with any damage, okay? You can't hire a lawyer over here and have a case, and it just won't happen. It's just not going to happen. Okay, now let's talk about the 2 individuals that have messaged me, okay? I'm not going to go into detail, but like I said, they both chose to go outside of their country. And they both are having trouble. And I feel terrible. I really feel terrible for them. I do. I don't know what to say. The only thing that I can do is let you guys know that things do happen. Let you guys know what I know, and hopefully prevent it from happening to someone else. I've never met any of you in person. Maybe a couple people. But I care about you. If I didn't care, I wouldn't be continuing with these videos, and I would not respond to every comment. I wouldn't respond to every post in my group that I can see. I wouldn't follow up with people if I didn't care. I care. I really do. And I don't want to see anyone else go through what the 2 people that I have talked to are going through. Okay, guys, but please take your time and do some research. I've said that before in another video, before you decide to go through implant surgery. I am not in any form or fashion trying to scare you or discourage you from getting implants. I'm going to be doing that. Sorry, my hair is sticking out. I'm going to be getting implants for sure on the lower when I have to have these extracted. You know, I had went in was supposed to be a consultation for extractions and implants on the lower, and it ended up turning into a consultation to have the teeth fixed or to fix the lowers. Because he had mentioned he thought that I should try to save them. And I agree to some extent, but with I've got 7 teeth left. I have nothing in the back to chew with. I'm starting to have some sensitivity and pain where I chew at, which is right here. That's a crown. I've got terrible periodontal disease. If I do have the cavities fixed and these crowned, I'm going the upkeep on them, you know, to continue with the gum cleanings and the periodontal visits. It's just, I can't afford it. I just can't. Now, if I was younger, you know, if I was in my early 30s or something, that might be something that I would consider. But, guys, I'm 43. I'm tired of going through the issues with the teeth. So, I'm not going to pay to have them fixed. For the money to do that, I can go ahead. I could probably have the all-on-4 procedure done and a bridge put in on bottom. I'm probably just going to go with 2 or 3 regular implants and a snap-in denture like I did for the top. I love it. I love my snap-in. The denturist did a fantastic job on it. It needs a hard reline, and I haven't done that yet because they're wanting to charge me. I have put out a call to his office, my doctor's office, his other office. I see him in one office, but he has a full-time practice in another area, and I had called that office, but I have not heard back from them. So I have a note made to call them on Monday to find out about this hard reline. I think my insurance will pay half of the cost. It's $459. So I'm going to see if they will, if he will agree to take what the insurance pays on it. So I will let you guys know when I find out. But what I was saying is I'm not just trying to discourage anyone from getting implants. It's a fantastic thing if you are in a position where you're going to lose your teeth. I'm just trying to say, make wise decisions. Do research. Really think about some things like going out of country, having the teeth done in a day. I mean, I understand you're not going to go without teeth. I know a lot of people have that fear where they think that if they go through something like me and they have the teeth extracted, they will do impressions and you'll have a temporary denture, okay? Now, it's going to take some time to get used to, but it's the best thing to do, guys. Let your mouth heal. You're more likely to have the implants last longer and to have a better outcome if you do it that way, okay? Now, I realize it is cheaper to go out of country, but there are, like, I got a good deal on my work. Some dentists in your area may run specials. Just keep your eye out. I don't know if there is a period in the year where it's slow for dentists. I doubt it. I would say they're probably busy year-round, but, you know, you could find a dentist and talk to them, and they may work something out with you. But the cost in the long run to go out of country, you're probably going to end up, you'll save money initially, like I said, but you'll probably end up paying what you would if you stayed in the U.S. because you'll have to go back. This is not something that you can go and have work done and come home and be ready to eat and just everything fine. You're going to have adjustments no matter what route you go. But I really care for you guys, and I just want what's best for you. And like I said, I had some information, and I just feel like if I didn't relay that to you all, I just had to. I had to relay it. So I'm done. I do have a giveaway going. It's a Christmas giveaway. I wasn't going to do any more giveaways until January, but I've changed my mind. There's a video. The last video I posted, it says Happy Thanksgiving on it. You need to watch that video and comment on that video to be entered into this giveaway. I'm going to give away a $25 gift card of your choice and then a goodie bag with some denture products. one winner. I can only draw one name this time, okay? You guys have a fantastic weekend. I've really enjoyed the time off. I haven't gotten much sleep. I didn't feel good Thanksgiving Day. And again, I apologize. I had taken some medication for nausea that I hadn't taken in a while, and it just made me really, really groggy. So I apologize for that. But have a great weekend, guys. If anybody has any questions, I will put the link to my group in the description. If you go in and request to join, if you're not already in, and then you can find me and send me a message that way. Or I'll leave my email address. If you'd rather do that, you can email me. Have a great weekend, and I'll be talking to you guys soon.